Minash-shaytanir-rajim. Bismillahir-rahmanir-rahim. So, in today's discussion, we are going to talk about the screening for Down syndrome. So, when we start the screening, we have this algorithm which is known as the contingency screen or the contingent screening method. In this case, we follow an algorithm, but no matter what algorithm we are following, the only thing that we have to offer during the first trimester is combined test. So if a woman comes to during first trimester, you're not going to choose any other thing, just the combined test. And when is it performed? It is performed from 11 to 14 plus 14 plus 2 weeks, not 14 plus 1 weeks. 11 to 14 plus 1 weeks. This duration reminds us of CVS, chorionic villus sampling, which is also performed during the same time period, that is 11 to 13 plus 6 weeks. But that's none of our concern right now. We're only concerned with the combined screening. So combined screening हमने कर ली 11 to 14 plus 1 weeks. अब what are we going to do in this? In combined screening, we have 4 things. Usually 3 things are written, but we also include maternal age. So the maternal age, then we have ultrasound, in which we only look at the nuclear translucency and nothing else. All other markers are the soft markers. They are not approved for proper screening. Then we have we also have we look at the pregnancy associated plasma protein A, which will be decreased, and we look at the beta HCG, which will be increased. So these 4 things. Now, on the basis of result of this, we do further screening. So now still we are following the contingency screening. We have done the first step, that is the combined test. We know when is it performed, we know how is it performed. Now we are going to check out the results of this test. On the basis of the results, we're going to classify the patient into 3 categories: high risk, intermediate risk, low risk. For low risk, you do nothing. For high risk, you do invasive testing. Invasive testing. What is invasive testing? CVS and amniocentesis. When are we going to perform CVS? We just discussed from 11 to 13 plus 6. When are we going to perform amniocentesis? From 15 weeks onwards. Now, what if you perform chorionic villus sampling before 10 weeks? There will be limb and mandibular defects. And what if you perform amniocentesis? Very nice writing. We perform amniocentesis before 14 weeks. There will be fetal loss, talipes, and respiratory morbidities, RFTs. Talipes, respiratory morbidity, fetal loss. Okay. Then based on the result, we're going to manage. Now, in intermediate risk, we're going to do cell-free DNA. This has an accuracy of 99% detection. What is the detection rate of combined screening? 90%. Okay, so this was the contingent screening method, but we should also know about other tests. The other tests, they include, we have triple test and we have quadruple test. So first trimester test was only one, we are done with it. Now triple test has 3 things, that is beta HCG, AFP, and estradiol, E2 estradiol. So beta HCG will be increased, these 2 will be decreased. In quadruple test, the same thing, 3 things, but we add one more thing, which is inhibin A. So this 4 things, quadruple 4 things. You should know when we are going to do quadruple test after the time period of combined test. What was the time period of combined test? From 11 to 13 plus 6. What is the time period for quadruple test? 14 to 20 weeks. So inhibin A and beta HCG will be increased in Downs. Beta HCG, other markers will be decreased. Beta HCG and inhibin A. And beta HCG will be decreased in Edwards and Patau syndrome. In these 2 it will be decreased, in Downs it will be increased. So this is what we have discussed so far. We have discussed about the combined test, 11 plus 2 to 14 plus 1. 4 things. Maternal age is also included, 90% detection rate. The only first trimester option you have. Then we have the triple test and the quadruple test, 14 to 20 weeks. And the duration of triple test is not mentioned.